choosing to get out or losing heart because their ability to earn an income is going down. How do you expect this nation to continue to attract quality people to medicine? Senator.
Well, a couple of things very quickly. Again, 30 seconds here. But first, obviously, providing some benefits to people who choose to go into that educational field and profession so we can attract them to work in areas that they're needed in. That certainly needs to be done. I believe there's an answer to the medical malpractice issue, not the ones the Republicans have been proposing, but that's one of the issues that people are concerned about, and as part of a larger health care plan, ought to be a part of that as we consider universality and other elements here to make sure that this profession becomes one where the cost of insurance, the cost of other items here are not going to be so excessive that you'd be discouraged from going that direction.
Senator, thank you. Senator Biden.
You got to help them pay off their education. They start off in the hole. They graduate and they have these gigantic bills, $40,000 a year. They graduate hundreds of thousands of dollars in debt. You got to give them ability to write that off if they engage in public service, move into areas where they need doctors, number one. Now, number two, you got to get the insurance company out and looking over their shoulders and everything. They know the decisions to make. They know what they should be doing, and they should be rewarded for their decisions. The light's on, and I want you to know I stay inside my time.
Very good. It's our new tough guy policy. Senator, thank you. Senator Edwards.
What we need is a universal health care system that gets doctors out of the business of having to deal with insurance companies on a daily basis to protect them from that. But I want to talk about another piece of this, which is we have a nursing crisis in America, a serious nursing crisis. So what we need to do is expand our nursing schools, give scholarships to young people who are willing, when they go to nursing school, to commit to come out and go to the places that are underserved. We need to get rid of things like mandatory overtime. We need to have safer staff-to-patient ratios so that we can deal with this crisis for the men and women who actually provide a huge amount of the health care in this country.
Senator, thank you. Senator Clinton.
Well, again, I agree with everything that has been said. In my proposal for the American Health Choices Plan, we basically give the insurance companies an ultimatum. They have to get into the business of actually providing insurance instead of trying to avoid covering people. They cannot deny people coverage. They cannot have a pre-existing condition which is not covered. That is one of the biggest problems that doctors face. They face this constant barrage of harassment and bureaucratization from the private insurance world. We also need to clean up Medicare and Medicaid. They're not as friendly as they need to be either.
Senator, thank you. Senator Obama.
We need to deal with the insurance companies. On Medicare and Medicaid, the reimbursement system is not working the way it should. And by the way, instituting a universal health care system that emphasizes prevention will free up dollars that potentially then can go to reimbursing doctors a little bit more. But we've got to deal with the cost of medical education. We have to deal with college costs generally, and that's why I put forward proposals to get banks and middlemen out of the process and expand national service to encourage young people to go into these helping professions where we need a lot more work.
Senator, thank you. Congressman.
I'm the co-author of the bill, H.R. 676, that establishes Medicare for all. As long as you have the private insurance companies involved in providing health services, people aren't going to get care. Doctors know that the insurance companies want to substitute their judgment for their practice. Everyone knows that the insurance companies make money not providing health care. I'm standing for Medicare for all. There is no one else on this stage who is ready to take on the insurance companies directly by saying we should join every other industrialized nation in the world by caring for our people, by having a not-for-profit health care system. Just because you say it's universal doesn't mean it's not for profit. Even the insurance companies want a universal health care system.
Thank you, Congressman. Governor Richardson.
Well, I have a specific proposal. Here it is. In exchange for 2 years of tuition paid by the government or loans, you give 1 year of national service to the country. This will attract more doctors and will enable students to afford a college education when it's taken them 7 years to pay for this. Get rid of the student loan and bank agencies that are ripping off the system. Reestablish on a general basis the doctor-patient relationship. Deal with Medicare reimbursement. Deal with ways that we also not forget health professionals, and that's nurses, that's others that in our healthcare system are not given the same opportunity.
Governor, thank you. Senator Obama, a question to you. More than one columnist covering the field of transportation has compared our current commercial aviation business to Aeroflot in the old Soviet Union. One writer said, hold on, that's insulting to Aeroflot. They have raised their service. The question to you is, how did this country get into a state where point-to-point air travel is no longer truly dependable, but more important, what would you be truly willing to do as president to fix it?
Well, this is a problem that's been building for a long time. The airlines got into trouble after deregulation, and it has continued and compounded, and they have now tried to make more money, and they're seeing better solvency, but they've done it on the backs of consumers. And anybody who's flying commercial knows that service has gone down and deteriorated further and further and further. So as President of the United States, we have to look at making sure that there's enough airport capacity. We've got to place potentially some restrictions on some flights and encourage airlines to deal with the problems of remote areas that are having difficulty in terms of making connections. But this is going to require the kind of leadership that we have not seen from this president, not just on transportation in the airlines industry, but in transportation generally. We haven't seen that kind of commitment on Amtrak. I'm sorry, I didn't realize there was a lightning round.
Yeah, sorry, the rules are in effect.
But generally speaking, this president has failed on this issue. We've got to keep on. We have to make a much bigger progress than we've done.
We should probably repeat. The lightning round continues with my colleague, Tim Russert.
Thank you, Brian. Senator Clinton,